The healthcare landscape is changing rapidly. The new Medicare Advantage Final Rule from CMS is more than a policy update. It represents a fundamental shift in how healthcare value will be measured, evaluated, and reimbursed. And for the orthotics and prosthetics profession, the implications are significant. Healthcare is moving away from volume based reimbursement and towards outcomes driven accountability. Payers are increasingly prioritizing providers who can demonstrate measurable improvements in patient outcomes, mobility, function, and quality of life. In this new environment, value is no longer assumed, it must be proven. For years, O&P providers have delivered life changing care, but historically, the profession has lacked the standardized, large scale outcomes infrastructure capable of demonstrating that impact consistently and longitudinally. As reimbursement models evolve, providers will increasingly face greater outcomes reporting requirements, more selective network participation, and increased pressure to justify clinical value. The question is no longer whether outcomes data will matter. The question is whether the industry will be ready. The Limb Loss and Preservation Registry was designed for this moment. The LLPR helps providers systematically capture, standardize, and report meaningful outcomes data across the limb loss and preservation population. Through objective measurement tools, longitudinal patient insights, benchmarking capabilities, and payer ready evidence, the LLPR helps transform outcomes data into strategic advantage. Without widespread participation in outcomes measurement, O&P risks being evaluated through incomplete data and proxy measures that fail to capture the true impact of care. But with participation, the profession gains the ability to define its value on its own terms, grounded in real patient outcomes. This is about more than compliance. It's about protecting patient access, strengthening the future of the profession, and ensuring O&P has a voice in shaping healthcare policy moving forward. The Medicare Advantage Final Rule raises the stakes, but it also creates an opportunity for O&P to lead, to demonstrate value, to strengthen outcomes, and to help shape the future of healthcare. Because in this new environment, value isn't assumed, it's proven.